Hip replacement ranks number 2 in terms of patient satisfaction of all surgeries in medicine. But here are 5 things that commonly surprise people after their hip replacement. I'm Dr. Randall Schultz, a patient, a surgeon, and your guide. I'm a board-certified orthopedic surgeon with more than 25 years of experience specializing in hip and knee replacement. Along the way, I've had the privilege of training residents and fellows and caring for thousands of patients. I've also been on the other side of the table. I've had a knee replacement myself. This is the Surgeon Unmasked. Welcome back to the channel. This is our 3rd episode in the 5 for 5 series. Thank you for watching. If you don't mind, please like, comment, subscribe. That'll help us a lot, and tell us you want to hear more of these. But here are 5 common things I hear in the office every day from people who have had a hip replacement. The first thing and the most common thing we hear about is leg length. First of all, none of us have the same leg lengths. We weren't born with the same leg lengths. Most of our lives, our leg lengths are very different. But when you have a hip replacement, suddenly your leg length changes within a matter of an hour or 2 with the operation. Now, most people go into hip replacement with that leg being a little bit short because we've lost some of the cartilage that coats the bone and provides some extra space. Some people will also even have some bone loss or collapse that makes the leg shorter overall as well. But when we restore that length, immediately it feels longer to just about everyone. Now, with modern hip techniques, we can generally keep leg length within about 5 millimeters of the other side. That's less than 1/5 of an inch. So generally, males are not real attuned to it. Females a little bit more. When we are in the 5 to 10 millimeter range, it takes a little bit more adjustment. But one of the things that drives me crazy is you don't want to immediately go to a lift in your other shoe to try and even yourself out. Your body, your pelvis has a remarkable ability to level and change in posture over time. But if you put that lift in there, you never really give your body a chance to level out, to become used to it, which will happen in time. Why do we make the leg long from time to time? Well, first of all, the most important thing is that we obtain stability in the hip. Hip replacements used to dislocate all the time. In the old days, dislocation rates were sometimes as high as 8 to 10%. Fortunately, now with modern techniques and better measurements, larger femoral head balls, the round ball that goes on the hip helps. We've been able to reduce dislocation rates to a much lower rate. Most series would show now we're probably under 1%. But if we leave that hip in too sloppy, too loose, it can pop out of the socket in what we call a dislocation. It's a terribly painful, terribly traumatic complication. And if it happens once, there's a very high chance it's going to happen multiple times, and you may have to have a repeat operation. So we always prioritize hip stability first, and that requires putting a little length and a little bit of what we call offset to create some tension in the joint to hold it in place. The hip is particularly vulnerable during the first 6 weeks after surgery. But I tell people all the time, we're very frank, we measure the differences, we know what they are. In fact, in surgery now, we can actually measure them more accurately than we could ever before with the use of live fluoroscopy. Some people can use computer generated images in surgery to help with it. I just try to reassure people that we know where it is. We try to keep it in this range, but we have to keep your hip stable and that you will adjust and adapt to it over time. The second most common thing I hear is people complaining about their knee hurting. Well, that's what we call referred pains. Very, very common. And the way the nerves work in the hip is that they go down towards the knee and also kind of serve 2 different areas. You may have heard some people, if they're having a heart attack, they'll have some left shoulder or left arm pain. It's a similar phenomenon. It's called referred pain. Now, there's other reasons after hip replacement. There can be some bleeding, some swelling that drifts down to the leg. The thigh muscle can be sore. And there probably is some bone pain that's being transmitted down. After all, we are putting a metal stem inside of the bone. The bone has to remodel. It has to strengthen at different places that it didn't before. And all that takes some time. But don't be alarmed if you have some knee pain afterwards. That's a common expected thing. In fact, when we do pediatric orthopedics, we're actually taught if they have knee pain or the kids complain of knee pain, you definitely look at their hips because many times they won't even know it's their hip. They think it's the knee that's hurting the whole time. The third most common one, and this is a big one, because I do the direct anterior approach in the majority of hip replacements. I like it. I think there's a lot of good ways to do hip replacements. I'll save that all for another episode. But just about everyone, nearly 100%, most studies would say 80%, but I think it's probably really closer to 100%, will have numbness in the thigh. The nerve is called the lateral femoral cutaneous. It is a skinny little skin nerve right at the surface, and so thin females are more vulnerable to having problems with it than larger people and larger males especially. It has no motor function. It doesn't create any weakness or paralysis, but just about everyone can expect a pretty large area of numbness in their thigh. And statistically, about 2/3 of those people will see it resolve over the course of a year. Another third will have some residual deficit. But I'll share a little story for you that when I was 12 years old, I had to have an emergency surgery on my thigh where they had to basically make an incision down the entire outside of my leg from my hip down to my knee to relieve pressure for what was called a compartment syndrome. And I'm so grateful they did it. Had they not, I could have lost my leg quite easily. It was an emergency, and that orthopedic surgeon became a role model to me and really one of the reasons I wanted to go into this field. I don't even think about that numbness anymore. I don't even notice it. And I tell people, reassure them, it could take a couple of years, but even if your numbness doesn't resolve, you eventually won't even be aware of it. And only a very small percentage, about 5 to 10% of people will actually have some pain in that nerve while it's recovering. We have ways to treat that with nerve medications, orally and topically, but generally it's just about reassurance and tell them, look, this is kind of the way it goes. It's going to do some really strange things too when it's trying to recover. Sometimes you'll feel like little bugs are crawling on your leg. Sometimes it's painful. Sometimes it's electrical sensations. I remember at times even feel like something was vibrating in my pocket, but that's all part of the nerve regeneration process. I have a funny anecdote to share with you. Just the other day, I saw a patient who took advantage of that situation for her own benefit and got a tattoo on her thigh while her leg was numb. Now, the sensation's now completely recovered, but you talk about making lemonade out of lemons. I was pretty impressed and got a chuckle. She did give me permission to use this photograph, by the way. Now, I don't recommend doing that. Please, we don't like dirty, sharp instruments, particularly anywhere near where you have an artificial prosthesis. We wouldn't want to see you get an infection, but nonetheless, it was a pretty funny moment. The other thing that will sometimes surprise people is the amount of swelling in their leg. It varies quite a bit, but you can expect some, and it's typically going to travel all the way down your leg because of gravity. There's going to be some blood that collects under the skin, under the muscle and the tissues. There's just going to be some generalized edema that occurs, but you're likely going to see your entire leg swell. You can help reduce that by elevation. I like to use compression stockings. Not everyone does. But I think probably the most important thing about swelling is knowing that it's not a blood clot, and it can be difficult to tell even for us. So particularly if you have some pain in the calf, behind the knee, or in the groin area, you probably want to let your provider know and get checked for a blood clot. It's a simple ultrasound to make sure that you don't. Blood clots used to be extremely common after joint replacement surgery because we kept people immobilized for so long. We kept them in the hospital for so long. They are fortunately far less common today because we get people up, we get them moving, we get them ready for surgery so they can get up and get moving. So we've seen that incidence drop tremendously. The final thing I see that tends to surprise people is that they have a metal implant and that they're going to set off metal detectors. Now, hip replacements are mostly titanium, and they're somewhat shielded more probably than knee replacements. So I have seen people get through metal detectors without setting it off. But when you travel, when you go to the airport, you don't need a card. They're not going to look at a card. You just need to declare up front that I have an artificial hip, and they will put you through the body scanners. Now, if they don't have a body scanners, you are going to have to go through the metal detector, and they'll need to wand you or pat you down. But generally, most bigger airports are going to have body scanners. Just declare it up front. They will put you through that line. And I've, with my knee replacement, never had a problem with it, except one time I made a mistake and I saw a shorter line at the metal detector and thought, well, I'll just go through that and get wanded. Well, I went through the metal detector, obviously set it off, and I had to wait 30 minutes for them to get a male to come down and wand and pat me down. I almost missed my flight. So don't make that mistake. The other thing about the implants being metal is, yes, you can have MRI scans. MRIs are sensitive to ferromagnetic metals, and titanium is very low on that scale. But regardless, these implants are very well secured. They're not going to move around from an MRI. Supposedly, they can heat up a little bit, but I've never heard anyone complain that they could actually even feel that. But what is difficult is if you want to MRI the actual joint, the area around that artificial implant. It generates a lot of what we call artifacts. So there's this bursting of light that occurs all around it, so they can't really see. They are getting better at it with a technique called MARS, which stands for Metal Artifact Reduction, which is a software enhancement where they can suppress some of that noise and actually see anatomic structures in the area. So those are the 5 things I typically see the most that surprises people about hip replacement. Again, the majority of people are extremely thrilled. Most worldwide studies show hip replacements have a satisfaction rate about 93%. And in fact, most studies would say that patient satisfaction is only exceeded by cataract surgeries. There is always the risk of complications, but fortunately, they're becoming fewer and fewer over time. It is my favorite operation to perform because generally it's far less painful than a knee replacement, a much easier recovery, and the results are so much better. In fact, a lot of people ultimately get to what we call a forgotten hip, where a couple of years from the operation, they hardly can remember which hip was replaced because it feels so normal and so natural to them. So thank you for watching today. Keep an eye out. I'll have a couple more episodes coming out. We'll see how this does and if we're going to do more of them. Again, my role here is to be your advocate to help you become an informed consumer. There's a lot of good information out there. There's a lot of misinformation out there. And I kind of want to give you a clear, hard, educated look at what the evidence actually shows, what really works, so that you can make good decisions for you and your healthcare.